32 years of nursing taught Celeste Delacroix to read fear in her patient's eyes. But when 24-year-old Iris whispered her secret request before routine wrist surgery, Celeste felt her professional world tilt off its axis. The young woman's trembling hands, the note hidden beneath her pillow, the desperate plea about a baby that did not exist in any medical record. What Celeste discovered in those archived security files would shatter her faith in the very system she had served her entire career. Sometimes the deepest wounds are not the ones we can see on X-rays and CT scans. Sometimes they live in the spaces between what happened and what we are allowed to say about it. Welcome to my channel, where I share real stories with unexpected twists. If you like what you hear, please hit subscribe and give me a thumbs up. It really means a lot to me. Now, let's begin this story. Celeste Delacroix had seen enough pre-surgery anxiety to recognize the usual patterns. The fidgeting hands that could not stay still, the rapid-fire questions about anesthesia risks, the family members hovering with forced smiles and whispered reassurances. But something about Iris Coleman felt different as she sat on the edge of her hospital bed that Tuesday evening, her legs dangling like a child's chair that was too high. The cyst removal was textbook simple. Dr. Peterson had explained it 3 times to the 24-year-old patient, using the same calm, confident tone that had reassured thousands of families over his 15-year career. 15 minutes under local anesthesia, home by noon the next day, back to her job at the downtown bookstore by Friday. The small bump on her wrist was nothing more than fluid-filled tissue, common as autumn leaves, easily removed with a tiny incision that would heal within days. Iris nodded at all the right moments, even managed a smile when the surgeon joked about her being able to shelve heavy books again within the week. Her responses were appropriate, her questions intelligent, her paperwork completed in neat handwriting that spoke of careful attention to detail. But Celeste noticed what the doctor missed in his efficient bedside manner. The way Iris's fingers traced her hospital bracelet like rosary beads, over and over in a rhythm that seemed to calm some invisible anxiety. How her eyes never quite met anyone's gaze during the medical explanations, instead focusing on points just past their shoulders, as if she were listening to something else entirely. The slight tremor in her voice when she said, "Everything sounded fine," a quiver that had nothing to do with the cool temperature of the hospital room. "Any other questions about tomorrow, sweetheart?" Celeste asked, settling into the worn vinyl chair beside the bed. The evening shift had started, bringing that particular quiet that settles over hospital corridors after visiting hours end, and the building exhales into its nighttime rhythm. Outside, the first October rain of the season tapped against the windows with fingers that sounded almost like Morse code. Iris shook her head, but her smile flickered like a candle in wind. "Just routine, right? Nothing complicated or dangerous?" "As routine as they come," Celeste assured her, though something in the young woman's tone made her stay a moment longer than protocol required. In 32 years of nursing, she had developed an instinct for patients carrying invisible burdens, the way some people can smell rain hours before it arrives. The room felt heavy with unspoken words. Iris pulled her knees to her chest, suddenly looking much younger than her 24 years, like a college student afraid to call home with bad news. The fluorescent lights hummed overhead with their familiar electrical whisper, and somewhere down the hall a television murmured the evening news to an empty waiting room. "Nurse Delacroix," she said quietly, "can I ask you something personal?" Celeste nodded, recognizing the shift toward deeper conversation, the way patients sometimes opened doors to rooms they had kept locked for months or years. Do you ever feel like hospitals remember everything except what matters most? The question caught Celeste off guard like a sudden change in weather. She studied Iris's face, seeing something profound swimming beneath the surface anxiety, like movement in deep water. "What do you mean by that?" "Medical records, insurance forms, procedure notes, billing codes. Every pill, every test, every minute of care gets documented." Iris looked down at her hands, which had finally stopped their restless movement. But not the person, not their story, not what they lost here. A chill ran down Celeste's spine that had nothing to do with the hospital's aggressive air conditioning. She had never heard a patient phrase it quite that way, but the words resonated with something she could not name, something about the sterile efficiency of modern healthcare that sometimes felt like it missed the beating heart of human experience. "Have you lost something here, Iris?" The young woman's eyes filled with tears. She quickly blinked away, the kind of practiced emotional control that spoke of months of keeping grief private. "Not this time, but before. 6 months ago." Celeste waited, letting the silence create space for truth the way good nurses learn to do, understanding that sometimes the most important information comes not in medical histories, but in the pauses between words. "I was pregnant then, 20 weeks along. Came in for what was supposed to be a routine prenatal checkup." Iris's voice dropped to almost a whisper, as if speaking too loudly might wake something that was better left sleeping. "Something went wrong with my medication. Wrong dosage," they said later. "I lost the baby that night." The words hung in the air like a confession, carrying weight that made the room feel smaller. Celeste felt her chest tighten with recognition, remembering her own losses, her own moments when medical systems had felt cold and distant during the most vulnerable times of her life. The institutional efficiency that could process tragedy like paperwork, reducing human devastation to incident reports and liability assessments. "I am so sorry," Celeste said, meaning it with every fiber of her professional and personal experience. "Did they tell you what happened? Who was responsible?" Iris shook her head, and something in that gesture carried years of unanswered questions. Just that it was a medication error, no details, no names. They said it was being investigated, but I never heard anything else. It was like Grace never existed. Grace? That was going to be her name. Iris touched her abdomen gently, a gesture so instinctive it seemed to happen without conscious thought. I had already bought her first Christmas ornament, already started reading to her at night. I just wanted someone to acknowledge that she was real, that she mattered. But the system just moved on to the next patient, the next case, the next day. Celeste felt something crack inside her chest. Not the sharp break of sudden injury, but the slow fracture of something that had been under pressure for years. She had always believed that following protocols protected patients, that the medical system's careful procedures ensured the best possible care. But sitting here with Iris, she began to see the gaps between policy and human experience, the places where institutional efficiency could accidentally erase the very people it was designed to serve. Is that why you are afraid of tomorrow's surgery? I keep thinking about being vulnerable again, about trusting people who might not even remember my name if something goes wrong. Iris looked directly at Celeste for the first time, and her eyes held a weariness that seemed older than her years. You are the first person who has asked me about it, about Grace, about what happened before. The evening deepened around them, and Celeste found herself thinking about all the patients she had cared for over 3 decades of nursing. How many had carried stories like this? How many had felt invisible within the very system designed to heal them? How many had learned to swallow their grief because there was no official place for it in the efficient machinery of modern medicine? Sometimes the most ordinary conversations reveal the extraordinary pain we carry alone. At 5:30 in the morning, while the hospital existed in that strange twilight between night and day shifts, Iris pressed a folded piece of paper into Celeste's palm as the pre-op team prepared to wheel her to surgery. Her hand was damp with nervous sweat, trembling like autumn leaves in an unpredictable wind. "If something happens to me," she whispered, her voice barely audible above the quiet efficiency of medical preparation, "give this to my mother. Her number is written on the back." Celeste tried to offer the standard reassurances about the simple procedure, the excellent surgeon, the minimal risks involved in what was essentially outpatient care. But Iris's grip tightened with surprising strength, her fingers digging into Celeste's palm with desperate intensity. "Please, promise me." "I promise." After the elevator doors closed with their soft, mechanical whisper, Celeste unfolded the note with hands that had suddenly developed their own tremor. It was a letter written in careful cursive, the kind of penmanship that spoke of someone who still believed handwritten words carried more weight than typed ones. It began with, "Mom, if you are reading this, something went wrong again." The words made Celeste's stomach clench with recognition of fear that went far deeper than any routine surgical procedure warranted. She stood in the empty hallway, reading words that felt like they were written by someone preparing for a journey with no guaranteed return. Iris had thanked her mother for 24 years of love, apologized for not being braver, asked her to donate her books to the literacy program at the community center. Most heartbreakingly, she had written a separate paragraph about Grace, asking her mother to visit the small memorial garden behind St. Mary's Church, where she had planted a rose bush 6 months earlier. The operation proceeded flawlessly. Dr. Peterson removed the cyst cleanly, with the practiced efficiency of someone who had performed the procedure hundreds of times. No complications, no unexpected findings, exactly as predicted. The surgical notes would read like a textbook example. Patient tolerated procedure well, no adverse events, expected full recovery within days. But when Iris woke up in recovery, she was not asking about her bandages, or when she could go home, or whether the surgery had been successful. She was crying with a depth of grief that seemed to come from somewhere far deeper than physical pain, the kind of sobbing that originates in places the human body was never designed to heal. "Is my baby okay?" she asked, eyes wide and searching the faces around her bed with desperate hope. The recovery nurse, a competent professional named Janet, who had been working post-op for 8 years, looked confused and slightly concerned. "Honey, you just had a cyst removed from your wrist. There is no baby involved in this procedure." "But Grace, is Grace okay?" Iris struggled to sit up, fighting against the lingering effects of sedation and the careful positioning designed to protect her surgical site. Celeste arrived as Iris became increasingly agitated, not responding to gentle reassurances about the successful surgery or explanations about post-anesthesia confusion. Something about her distress felt familiar to Celeste, triggering memories she had buried from her own experience with medical trauma 15 years earlier. Memories that lived in a carefully locked room of her heart. She had been 37 then, finally pregnant after years of trying, countless fertility treatments, and the kind of hope that grows more precious as it becomes more fragile. The pregnancy had been progressing beautifully until a pharmacy error led to a miscarriage at 18 weeks. The investigation had been swift and quiet, conducted with the institutional efficiency that prioritized system improvement over individual grief. The pharmacist received additional training, the protocols were updated, the incident was classified and filed. But nobody had asked how she felt about losing the daughter she had already named Emma, already loved with the fierce intensity that comes when hope has been hard-earned. Nobody had acknowledged that Emma would have been born in spring, that her nursery had been painted yellow with white clouds, that Celeste had been practicing lullabies she remembered from her own childhood. "Iris," Celeste said gently, pulling a chair close to the recovery bed, "tell me about Grace." It took 2 hours and several cups of terrible hospital coffee for the full story to emerge, told in fragments between tears and moments of exhausted silence. 6 months earlier, Iris had been 20 weeks pregnant, glowing with that particular radiance of first-time expectant mothers. She had been working at the bookstore, creating reading lists for the baby, imagining all the stories they would share together. The routine prenatal appointment should have been simple blood work, measurements, and the 20-week ultrasound that would reveal whether Grace was growing, according to schedule. Instead, a nursing intern working a double shift had mixed up medication charts in the early hours of morning when fatigue makes even careful people careless. Iris received a drug contraindicated for pregnancy, a medication that should never have been administered to someone carrying a child. The dose was appropriate for the intended patient, a 70-year-old man being treated for cardiac issues, but devastating for a developing fetus. By the time anyone realized the error, the damage had been done. Grace died that night, and Iris delivered her daughter in a labor room that felt more like a crime scene than a place of healing. "I did not want to sue," Iris explained, staring at her bandaged wrist as if it might provide answers to questions that had haunted her for months. "I just wanted to understand what happened. Who made the mistake? I wanted them to know that Grace had a name, that she was real, that losing her mattered more than whatever legal settlement they were worried about." "What did they tell you?" "That it was under investigation, that they would review protocols to prevent similar incidents, that these things happen sometimes in complex medical environments." Iris's voice carried a flatness that spoke of hope, crushed by bureaucratic language designed to minimize rather than acknowledge. But I never heard another word. No follow-up calls, no updates on the investigation, no explanation of what changes were made. It was like she never existed. Celeste felt anger rising in her chest, not the quick heat of momentary frustration, but the slow burn of institutional injustice. She thought about her own experience, how the system had focused on preventing future errors, while barely acknowledging the life that was lost, the dreams that died, the future that would never unfold. "Did you ever get any details about the investigation?" "Nothing. I called the hospital several times, but they said it was confidential. Personnel matters could not be discussed with patients, even when those patients were the ones who suffered the consequences." Iris looked up with eyes that had aged beyond her years, carrying the weight of unanswered questions and unacknowledged grief. "I just wanted someone to say her name, to admit that my daughter died because of their mistake, to show me that her life mattered enough to remember." That afternoon, Celeste found herself doing something she had never done in 32 years of nursing. She walked down to the medical records department, past the familiar smell of copying machines and filing cabinets, and asked to review archived incident reports from 6 months earlier. The clerk, a tired-looking woman named Patricia, who had worked in records for 2 decades, assumed it was official business and handed over the files without question. What she found made her hands shake with fury and disbelief. The medication error was clearly documented in clinical language that reduced human tragedy to procedural failure. The intern responsible was named Harrison Blake, now a second-year resident in pediatrics. The incident had been classified as a Level 2 error, requiring additional training, enhanced supervision, and mandatory counseling about the importance of double-checking patient charts during night shifts. But nowhere in the file was any mention of Grace, no acknowledgement that a baby had died, no record of follow-up with the patient about her emotional state or psychological needs. No documentation of the grief counseling that should have been offered or the bereavement support that might have helped a young mother process her loss. The human cost had been completely erased from the official narrative, leaving only the institutional response to procedural failure. Celeste sat in her car in the parking garage, staring at the photocopied report, while rain drummed against the windshield like tears. She felt her faith in the medical system crumble like pages from an old book. Everything she had believed about healthcare's commitment to healing human beings rather than just treating medical conditions. Truth has a way of demanding our attention when we least expect it. Celeste could not sleep that night. Every time she closed her eyes, she saw Iris's face asking if Grace was okay, heard the clinical language that had reduced a daughter's death to procedure codes and training requirements. She thought about her own Emma, about all the patients over the years who might have carried similar stories, similar grief that had no official place in the efficient machinery of modern medicine. By morning, she had made a decision that would change everything about how she understood her role as a nurse and her responsibility to the people who trusted her with their most vulnerable moments. She requested a meeting with Dr. Martinez, the hospital director, bringing copies of the incident report and her own documentation of Iris's emotional state during recovery. She expected resistance, but not the immediate hostility that greeted her concerns, the way his expression shifted from professional courtesy to defensive calculation. "Nurse Delacroix, you have accessed confidential personnel files without proper authorization. Dr. Martinez said, his voice sharp with the kind of disapproval reserved for employees who step outside prescribed boundaries. This is a serious breach of hospital protocol and patient privacy regulations. A patient lost her baby because of a medication error 6 months ago, and she has never received any acknowledgment, explanation, or apology, Celeste replied, fighting to keep her voice steady despite the adrenaline that made her hands tremble. That seems more serious than protocol violations. The incident was thoroughly investigated by our quality assurance team. Appropriate remedial measures were implemented. Enhanced training protocols were established. The matter was handled according to industry standards and is now closed. Closed for the hospital, maybe. Not for the mother who is still grieving a daughter whose death was never officially acknowledged. Dr. Martinez leaned back in his leather chair, studying her with the calculating gaze of someone weighing risks and benefits, institutional liability against employee management. The silence stretched between them like a fault line, revealing the gap between administrative efficiency and human compassion. Nurse Delacroix, you have been an exemplary employee for over 30 years. Your performance reviews are consistently outstanding. Your patient satisfaction scores are among the highest in the department. His tone shifted to something that might have been paternal concern if it had not carried such clear undertones of threat. Do not let misplaced sympathy jeopardize a distinguished career. The threat was crystal clear, wrapped in the language of professional guidance. Celeste felt the familiar weight of institutional pressure, the way systems protected themselves by making individuals choose between compliance and conscience, between job security and moral courage. What about Dr. Blake? Does he even know what happened to the baby? Personnel matters are strictly confidential. The resident received appropriate supervision and completed mandatory additional training in medication administration protocols. These quality improvement measures have been fully implemented to prevent similar incidents. But he does not know about Grace. He does not know her name or that she died because of his mistake. Dr. Martinez's silence was more eloquent than any direct answer could have been. That afternoon, Celeste did something that would have been unthinkable a week earlier, something that violated every unwritten rule about hierarchical communication and professional boundaries. She looked up Harrison Blake's schedule and found him during his afternoon break in the pediatric ward, where he was reviewing patient charts with the intense focus of someone still proving himself in a demanding profession. He was younger than she had expected, maybe 28, with the kind of earnest concentration that spoke of someone who took his responsibilities seriously. Dark circles under his eyes suggested the chronic exhaustion of residency, and his movements had the careful precision of someone who had learned to double and triple check everything after making a mistake that mattered. Dr. Blake, I need to speak with you about a case from 6 months ago, a medication error involving a pregnant patient named Iris Coleman. His face went pale immediately, color draining away like water from a broken glass. I remember the case. The pregnancy was lost. It was absolutely terrible. Do you know her name? He hesitated, clearly trying to recall details that had probably been deliberately obscured by administrative protocols designed to minimize emotional attachment. The patient? I think it was Coleman, right? Her name is Iris. The baby's name was going to be Grace. Dr. Blake sat down heavily in the nearest chair, as if the words had physical weight that his legs could no longer support. "Grace?" he repeated quietly, like he was testing how the name felt in his mouth. "Nobody ever told me her name, the baby's name. Iris is here now, recovering from wrist surgery. She has been carrying this grief alone for 6 months, with no answers, no acknowledgment, no contact from anyone involved in her care. She just wanted someone to say Grace's name and admit that her daughter's death mattered." "I wanted to reach out," he said, his voice barely above a whisper. "Every day since it happened, I have thought about calling or writing a letter. But administration said any direct contact could create legal liability for the hospital. That the best thing for everyone involved was to let the quality improvement process handle it quietly and professionally." Celeste saw her younger self in his conflicted expression, the way good intentions could get tangled up in institutional self-protection, how systems could isolate the very people who most needed to connect with each other in order to heal. The quality improvement process is over. The protocols have been updated, the training has been completed, but Grace is still dead, and her mother still does not know what happened or why or who was involved in the mistake that cost her daughter's life. What should I do? What can I do at this point? It was the question Celeste had been asking herself for days, the question that had kept her awake and made her challenge her supervisor and forced her to choose between comfortable compliance and difficult truth-telling. The answer came not from 32 years of training or hospital policy manuals, but from some place deeper, where human connection mattered more than liability concerns. Tell her about Grace, acknowledge what happened. Let her grief matter as much as the system's procedures do. When Dr. Blake knocked on Iris's door that evening, Celeste watched from the hallway as two people who had been kept apart by institutional barriers finally met as human beings, dealing with shared tragedy. She could not hear the words, but she saw Iris's shoulders shake with sobs that seemed to come from the deepest places of held pain, the kind of crying that happens when grief finally finds a witness. The conversation lasted almost an hour. Celeste saw Dr. Blake's own tears, saw him sitting beside Iris's bed in the posture of someone asking for forgiveness, saw the moment when professional distance dissolved into human connection. Later, Iris found Celeste at the nurse's station, her eyes red from crying, but somehow clearer than they had been since her admission to the hospital. "He said her name," she whispered, wonder and relief mixing in her voice like medicine that actually healed. "He said, Grace, and he told me he was sorry. He told me he thinks about her every day. That is all I ever wanted." Rock bottom becomes the foundation on which we rebuild. 3 months later, Celeste stood in the hospital's new memorial garden, watching workers install a wooden bench beside the small oak tree Iris had donated in memory of her daughter. The morning air carried the scent of fresh mulch and the promise of spring. And somewhere nearby, a cardinal sang from branches that would soon be heavy with new leaves. The plaque mounted on a simple stone marker read, "In memory of Grace Coleman and all the stories that need to be heard." Below that, in smaller letters, "Sometimes healing begins when we say their names." The garden had been Iris's idea, conceived during one of her regular visits to see Dr. Blake and Celeste, but it had taken months of meetings, committee reviews, and administrative negotiations to become reality. Celeste had used her 3 decades of accumulated credibility and respect to push the proposal through multiple layers of hospital bureaucracy, arguing that acknowledging loss and creating space for grief were essential components of comprehensive patient care. Dr. Blake visited the garden regularly, often bringing pediatric residents and medical students to talk about the weight of medical decisions and the importance of seeing patients as complete human beings, rather than collections of symptoms and diagnoses. The medication error protocols had been updated with new safeguards and checking procedures, but more importantly, staff training now included mandatory sessions on communicating with patients and families about adverse events, medical errors, and the human impact of systemic failures. The hospital had also implemented what they called the GRACE protocol, a system that required follow-up contact with any patient or family affected by medical errors, not for legal protection, but for emotional support and honest communication about what happened and why. It was imperfect and sometimes awkward, but it represented a fundamental shift toward acknowledging that healing required more than just fixing problems. Iris had written a letter to Dr. Blake several weeks after their first conversation, not seeking legal action or financial compensation, but requesting ongoing dialogue about medical error prevention and patient advocacy. That letter had somehow found its way to nursing schools and medical programs across 3 states, becoming part of required coursework about patient communication, professional responsibility, and the moral courage required to prioritize human connection over institutional comfort. It completely changed how I practice medicine, Dr. Blake told Celeste during one of their periodic check-ins in the Memorial Garden. I think about grace every time I write a prescription, every time I make a decision that affects someone's life or future. Not in a paralyzing way that makes me second-guess everything, but as a reminder that real people with real families are trusting me with their most precious hopes. The hospital administration had initially resisted both the Memorial Garden and the Grace Protocol, concerned about liability implications and the precedent of acknowledging errors so directly. But when patient satisfaction scores improved dramatically, and several families specifically mentioned feeling heard and valued during difficult medical situations, the leadership began to understand that acknowledging human experience actually enhanced rather than threatened institutional reputation. Celeste found herself in a newly created position, officially titled Patient Experience Advocate, but functioning more like a bridge between clinical protocols and human emotional needs. She helped develop systems where patients could request follow-up conversations about adverse events, where families could share impact statements about how medical errors affected their lives, where healthcare providers could engage in honest dialogue about mistakes and learning without fear of automatic legal consequences. The work was not easy and did not solve every problem. Some patients remained angry despite sincere apologies. Some families pursued legal action regardless of institutional acknowledgment. Some healthcare providers struggled with guilt and self-doubt even after receiving forgiveness from those they had inadvertently harmed. But the overall culture began shifting toward greater transparency, more honest communication, and deeper recognition that medical care was fundamentally about human relationships rather than just technical procedures. Iris had returned to her job at the downtown bookstore, but also began volunteering with families who had experienced pregnancy loss, infant death, or medical trauma. She organized support groups that met monthly in the hospital's conference room, creating space for stories that the medical system often overlooked in its focus on future prevention rather than current grief and healing. Grace taught me that healing is not about forgetting what happened or pretending it does not matter. Iris said during one of these gatherings, her voice carrying the hard-earned wisdom of someone who had transformed personal tragedy into communal healing. It is about remembering in ways that honor what was lost while still allowing hope for what might come. It is about making sure their names are not forgotten. Celeste often found herself thinking about her own daughter, Emma, the pregnancy she had lost 15 years earlier to a pharmacy error that had been handled with the same institutional efficiency that initially surrounded Grace's death. She had carried that grief quietly for years, following the unspoken expectation that moving forward meant not looking back, that healing required forgetting rather than remembering. But watching Iris find peace through acknowledgment rather than silence, seeing Dr. Blake transform his guilt into more compassionate patient care, witnessing how honest conversation about medical errors could actually strengthen rather than weaken the healthcare system, she began to understand that some wounds need witnessing before they can truly close. She had started visiting Emma's grave more regularly, bringing flowers and reading aloud from books she had planned to share with her daughter. It was not about reopening old wounds, but about giving them the attention and respect they deserved, about refusing to let institutional efficiency erase the reality of love and loss. The memorial garden grew throughout that first year. Other families contributed plants and stones, small markers that acknowledged children who had died, patients who had been lost, moments when the medical system had failed to protect the people it was designed to serve. It became a place where grief could exist alongside hope, where professional dedication could coexist with human vulnerability. Love is not about perfection. It is about showing up imperfectly, but consistently. If this story touched something in your heart, I would love to hear about it in the comments below. Sometimes the most important conversations start when we stop protecting ourselves from difficult truths and start protecting each other through honest connection and genuine acknowledgement of both our failures and our capacity for healing. Until next time, remember that your story matters. The people in your life need to hear it, and sometimes the bravest thing we can do is say the names of those we have lost.